An abdominal aortic aneurysm, AAA, is a swelling, aneurysm, of the aorta, the main blood vessel that leads away from the heart, down through the abdomen to the rest of the body. The abdominal aorta is the largest blood vessel in the body and is usually around 2 centimeters wide, roughly the width of a garden hose. However, it can swell to over 5.5 centimeters, what doctors class as a large AAA. Large aneurysms are rare, but can be very serious. If a large aneurysm bursts, it causes huge internal bleeding and is usually fatal. AAAs are most common in men aged over 65. A rupture accounts for more than 1 in 50 of all deaths in this group. Symptoms of an AAA, unruptured. In most cases, an unruptured abdominal aortic aneurysm, AAA, will cause no symptoms, unless it becomes particularly large. Symptoms of an unruptured AAA may include a pulsating feeling in your stomach, abdomen, usually near your belly button, that's usually only noticeable when you touch it. Persistent back pain, persistent abdominal pain. If you have any of the symptoms above, you should see your GP as soon as possible. Ruptured AAA. If your aortic aneurysm ruptures, you will feel a sudden and severe pain in the middle or side of your abdomen. In men, the pain can also radiate down into the scrotum. Other symptoms include dizziness, sweaty and clammy skin, rapid heartbeat, tachycardia, shortness of breath, feeling faint and loss of consciousness. Medical emergency. A ruptured aortic aneurysm is a medical emergency, and it's important to get to hospital as soon as possible. Around 80% of people with a rupture die before they reach hospital or don't survive emergency surgery. This is why the NHS AAA screening program was introduced, so dangerously large aneurysms can be treated before they burst. If you suspect that you or someone in your care has had a ruptured aneurysm, call 999 immediately and ask for an ambulance. Causes of an AAA. It's not known exactly what causes the aortic wall to weaken, although increasing age and being male are known to be the biggest risk factors. There are other risk factors you can do something about, including smoking and having high blood pressure and cholesterol level. Having a family history of aortic aneurysms also means that you have an increased risk of developing one yourself. Diagnosing an AAA. Because AAAs usually cause no symptoms, they tend to be diagnosed either as a result of screening or during a routine examination. For example, if a GP notices a pulsating sensation in your abdomen, the screening test is an ultrasound scan, which allows the size of your abdominal aorta to be measured on a monitor. This is also how an aneurysm will be diagnosed if your doctor suspects you have one. Treating an AAA. If a large AAA is detected before it ruptures, most people will be advised to have treatment to prevent it rupturing. This is usually done with surgery to replace the weakened section of the blood vessel with a piece of synthetic tubing. If surgery is not advisable, or if you decide not to have it, there are a number of non-surgical treatments that can reduce the risk of an aneurysm rupturing. They include medications to lower your cholesterol and blood pressure, and quitting smoking. You will also have the size of your aneurysm checked regularly with ultrasound scanning. Prevention. The best way to prevent getting an aneurysm, or reduce the risk of an aneurysm growing bigger and possibly rupturing, is to avoid anything that could damage your blood vessels, such as smoking, eating a high-fat diet, not exercising regularly, being overweight or obese.